everyone. Today we are going to discuss the mechanism of mannitol, and we will go into the concept of how the mannitol is used to decrease the intracranial pressure as well as the intracranial volume, and why it is used in intracranial hemorrhage or intracranial increased pressure. So first of all, we will go into the mechanism. As you all know that it is an osmotic diuretic. This osmotic diuretic, how it is an osmotic diuretic is, it is actually a sugar alcohol. So first of all, we have to know two important concepts. One is that when it is added in the blood, it actually increases the osmolality of blood. So it increases the osmolality of the blood. The second concept is that when a fluid or a blood is moving through a membrane, it actually always moves toward high osmolality area. This is the basic concept. So what does mannitol do? So actually mannitol, here as you can see, this is the blood vessel in which we are going to add mannitol or any osmotic diuretic. And this is, you can see, this is the brain, and we can imagine that this brain is swelled due to some intracranial hemorrhage. Sorry. And when there is increased intracranial pressure as well as increased intracranial volume here, so when we are going to inject this mannitol into this blood vessel, it is not going to cross the blood-brain barrier. This is the blood, and this is the blood, and this is the brain. So there is a barrier in between, so that actually mannitol is not going to cross this barrier. It is actually staying here into the vessel. So when it is actually staying into the vessel, it is causing increase in the osmolarity of the blood. So when it is causing increase in the osmolarity of the blood, what is it actually leading to? It is actually leading to transfer of the fluid towards the blood vessel. So actually by increasing the osmolality of the blood, it is causing shift of the blood, shift of the fluid from the brain toward the blood vessel. So it actually first of all increase the plasma osmolality that cause the movement of the blood toward the vessel, so ultimately leading to the intracranial volume, lowering the intracranial volume and lowering the intracranial pressure. So what actually it does when it is moving toward the kidney? So imagine here, this is the kidney that is already drawn, and this is the actually magnified image of nephron. So here this is the renal vessel, and the renal vessel is ultimately leading to afferent and the efferent arteriole. So we have to note one important thing here, that when the blood that is actually taking this blood, taking all the fluid from the brain comes to the kidney, what happens? So renal vessel that is actually taking all the blood, all the extra fluid, what here it happens? Here in the glomeruli, this here, what happening now? Now all of the mannitol that is actually the osmotic diuretic is freely filtered here in the Bowman space. I will magnify it for you. This is the afferent and this is the efferent. So all the blood coming here will actually cause the filtration of filtration of the mannitol here, here and here. So all of the mannitol is filtered into the renal tubule. So when it filters into the renal tubule, it actually increases the osmolality here. So when the osmolality here increases, what happens? As I told you earlier, that fluid always move toward increased osmolality. So when the osmolality is increased in the renal tubule, it will prevent the movement of the fluid toward the blood vessel or toward the interstitium of the kidney. As I can show you, first of all I have to erase all of this, as I have lack of space, so I will draw again. So this is the loop of Henle, and most of the absorption take place here in the descending loop, because there is no absorption of any of the electrolyte like sodium or chloride in this descending limb. So most of the water is reabsorbed here, but when there is increased osmolality due to the mannitol, this is prevented, so that all of the tubular fluid carrying the osmotic diuretic, that is mannitol, will ultimately lead to increased diuresis. That is why it is a good osmotic diuretic. So what will be the effect on plasma osmolality? What will be the effect of mannitol on sodium concentration of the blood, and what will be the effect on the glomerular filtration? So we will see that one thing. First of all, when it actually enters the blood, it causes the increased plasma osmolality. When it causes shift of the fluid from other part of the organs or any other part toward the plasma, it is actually causing dilutional hyponatremia. So what is dilutional hyponatremia? As you can see that this is the vessel, and this is, for example, brain. So when the water is moving here, that means there is increased content of water. So when increased content of water, the content of sodium will decrease. And why it is so? It is because with the water increase, the sodium concentration will drop in comparison to water. It will dilute, and as you can see through this, when it enters to the glomeruli and filtered in the Bowman capsule, it is actually causing increased glomerular filtration. Why it causes increased glomerular filtration? Because it is almost all of the mannitol that was actually filtered in the Bowman capsule, and as you can see that it is decreasing here the reabsorption of water, so it will cause an increase in the renal tubular flow. And another thing, that it is also causing the hyperosmolar glomerular filtrate. Why it is so? Because this is the glomerular filtrate, all of this, and this, its osmolality is increased due to the hyperosmolar mannitol, and that ultimately reduce reabsorption of water and cause increased diuresis. Thank you very much.